one of the things that council that I formed, which includes all of those physicians, took on as our first step of action was to identify an executive director for the hospital here, in the hospital system here in Chestertown. We heard through the community listening sessions that was a true need that the community felt was necessary, and we believed in that need as well, and one of the first orders of business of our council was to identify our executive director for Chestertown. And believe it or not, we had 8 different applicants who were interested in that position, and at the end of the day we reached consensus, unanimous consensus on who the executive director for Chestertown would be. And I'm pleased to introduce Scott Burleson, who's here with us this evening. Scott Burleson, who is also a pillar in the community, who is well respected by our physicians and our administrative team alike and our board of directors, has been assigned the role of executive director, sits with me at the senior leadership meetings, reports directly to me, and sits in at the board meetings as well, so plays a critical role in our planning and strategy for Shore Regional Health moving forward. So I'm pleased that those things have materialized since the last time we met, and I think again it attempts to demonstrate our commitment and our collaboration efforts that we're trying to work with you on. So in addition to those things, what I'm here about today is to share with you some follow-up from 18 months of study, evaluation, and discussion by our board, our physicians, our management teams, team members, elected officials, and community members from all 5 counties that we serve. Our Shore Regional Health Strategic Service Delivery Plan. And that plan was approved by our board of directors at the University of Maryland Shore Regional Health in June of this year. So the service delivery plan that was just approved reflects future planning needs identified in 5 strategic clinical service lines, and also incorporates regional transportation needs and recommendations for transportation as well. The plan becomes part of the Shore Regional Health Strategic Plan for the next 5 years, so that'll take us up to 2021. One of the key elements of the plan that we were required to answer and address is the status of the replacement hospital in Easton. That is a component of our overall service delivery plan, and that was an unanswered question that the committee was tasked to address. So regarding the certificate of need, a key element was to update the docketed certificate of need to replace the existing hospital in Easton with a new facility on our property owned near the Talbot County Community Center right off of Route 50 in Easton. And our board has approved the updating of that CON application, and that updated application will be submitted in September of this year and submitted to the Maryland Healthcare Commission as part of our regulatory body for the state. We anticipate that decision by the state will take upwards of a year as they evaluate our application and come back with recommendations and approvals. Hospitals and inpatient beds in Chestertown and Cambridge are not affected by the CON. This is a CON for the replacement of Easton only. And it's designed to address costly aged infrastructure at Easton, private room capacity, and state-of-the-art future patient care unit design for our Easton campus. So that was one of the big key elements of the plan, was to identify the status of the CON application, and it was approved to update it and submitted in September. In addition to the CON application, one of the things that our service delivery plan committed to was quality healthcare services and jobs in Chestertown and Kent County, focused upon state-of-the-art medical care, emergency care, access to physicians and specialists, and robust outpatient services. Our plan calls for supporting the excellence of inpatient care at the hospital in Chestertown until at least 2022, with continued feasibility of our inpatient services to be evaluated in light of the state's rural study that's getting ready to take place next month. So in addition to the plan identifying the updated CON, as well as the commitments, reiterating the commitments that we've made to Chestertown, the plan really addressed 5 key service lines that are critical to acute care hospitals' success in rural Maryland. And those 5 service lines include primary care, which includes obstetrics, gynecology, and pediatrics, medical specialties, surgical specialties, oncology, and behavioral health. Again, all critical and foundational to acute care facilities. Some of the common themes that our plan identified included addressing the challenges of transportation in our region. 5 counties, huge geography, huge distance between some of the main population centers, so identifying the transportation needs is critical to our success for the study. It also identified that there are significant physician shortages in all parts of our 5-county region, and the plan addresses what those shortages are and how they can be addressed. And then, again, back to the specifics of the Chestertown Physicians Council, they will be instrumental in helping us identify what specialists need to come to Chestertown, and also help us as part of the recruitment process for bringing those new docs in. Improved communication and enhanced technology was also a common theme through all 5 of those councils, as was support for chronic disease management and care coordination. Those are our sickest patients, so we really need to make sure that we have the tools and resources necessary to address those sick patients, as well as coordinate the care from one location to another, since those patients require multiple stops of care. And then finally, expand community outreach, education, screening, and support. I think that's a critical, common theme that we identified in all 5 of those councils. So just to give you a flavor for what the councils identified, if we want to look at primary care, I mentioned a significant need for primary care in this region. The plan calls for identifying locations within the 5-county regions, the numbers of primary care physicians we need, and the recruitment process and timeline for doing that. And as you know, if we're into a population health mindset, primary care is foundational to that success. So our efforts are short-term, medium-term, and long-term over the next 5 years to retain existing primary care providers and recruit additional primary care providers to all 5 counties in our region. So that's critically important to our success. When we talk about medical specialties, the specialists that support the primary care physicians, we've identified a number of those specialists. And again, many of them are specific to the locations based on what's there today and what's needed, but we've identified that specialists like endocrinology, rheumatology, pulmonology, and sleep, and cardiology are all critical to our long-term success. The plan also talks about surgical services. That's the 3rd of 5th major groups, and continuing surgical services at Chestertown, Cambridge, and Easton, while looking at expanding robotics. That's a special type of surgery using robotics for some of our patient population, and expanding surgical specialists in areas that we have medical office buildings, like the new one that we just opened here in Philosopher's Terrace, like the one in Easton, like the one in Denton, and like the one in Cambridge. And I'll pause and just take a second to thank members of the town council who came to our ribbon cutting ceremony at our Philosopher's Terrace venue last week. I hope you had a chance to tour that venue. I think it's a fantastic site. It's a consolidated location for primary care and specialists right now in the backyard here. So I'm very pleased with how it's come, and I thank the town council for your support in attending that. And finally, as we talk about behavioral health services, you can't pick up the paper these days without recognizing that the country has behavioral health issues, the state of Maryland does, as does the Eastern Shore. So really working with our partners in our behavioral health service lines to identify care, urgent and therapeutic care that our patients need, and then providing access to those support services for those patients is critically important to our success. So that's just a flavor of the service delivery plan that the Board of Shore Regional Health approved in June. And our plan is that the board has authorized management, myself, my team, to operationalize the recommendations from that service delivery plan over the course of the next 5 years. And we'll do that with short-term and long-term objectives, and we'll implement those as part of our annual operating plan, which the board reviews on a quarterly and annual basis. So all ties back into our strategic plan for our organization and covers the 5-county region, but where it's necessary focuses on those key parts of our community where we've made commitments. So with that, I'd be happy to answer any questions you have about the latest and greatest happenings at Shore, and specifically the service delivery plan if you have any.
I think for this community, you know, when we had the town meeting, for example, I think the biggest concern is losing our inpatient beds. Really more than almost, I mean, yes, we want to keep all the services we have now, but I think the inpatient beds, just from a distance standpoint, if we were to lose that, that would be a big hit for us as a community. So I just want to make sure I heard this correctly, that you were saying that you were going to maintain inpatient beds through 2022.
That's correct.
And then what happens at that point? Would you then reevaluate based on the state's study and how things have played out over that 6-year period?
That's exactly right, Mayor. The state study is going to be very revealing as to how the state recognizes they can support rural hospitals like us, and they know very clearly the geography challenges we've got on the mid-shore. So I'm sure geography and the need for inpatient beds will be a key component of that state study. So based on the outcome of that, and as healthcare progresses over the next 5 years, those will be key elements of where we go in the future.
And then I think sort of tied on to that sort of concern for our community is the certificate of need for the Easton facility. And what I thought I heard you saying is that you guys are going to move forward with the application to basically establish a need for, I'm not sure if it's a new hospital in Easton that completely replaces the one in Easton. Is that correct?
That's a good question, and thank you for letting me clarify. Yes, it's for a new hospital that replaces the existing hospital in Easton and puts that new hospital out on the airport, out near the airport in the community center on Route 15 Easton. The disposition of the hospital, once we vacate that, is a decision we're going to work collaboratively with on the town and the county and some key citizens to try to help us look at options and what works best for the three of us, the town, the county, and the shore. But yes, we will relocate that facility if we get the approvals once it's built out near the airport.
And then my follow-up, sorry, Mark. And my follow-up to that would be, would that be envisioned as a substantially bigger, you know, kind of like more like a master hospital than, would it be a significantly larger facility than what's currently in Easton? Because again, I think the sort of the undercurrents in our community is, you know, they're going to build this big master hospital in Easton, and we're all essentially going to be feeders to sort of the central cog in the machine, which I think is what led ultimately to our concern over the inpatient beds. So I don't know if you have a vision for what that facility will look like, or if it'll just basically be what you have in Easton, but brand new and modernized.
I believe it's the latter, Mayor. It's what we've got in Easton, but brand new and modernized. The bed count is a state-driven exercise, and they will determine the number of beds based on what Easton uses. Not what Chestertown has, not what Cambridge has, but what Easton has and uses. We anticipate that it will likely be less than what we have today in Easton. So, but there will be some, at least one additional service that will add on to the new hospital that doesn't exist today, and that's the capability to do PCI testing. PCI stands for percutaneous coronary intervention. It's just a fancy medical term for removing stents or blockages, putting a stent in to remove blockages in your heart vessels. We don't offer those services today. We didn't when we applied for the CON a few years ago, but the state has approved us providing that service in Easton, so that will need to get added to the application and some additional space added to the facility for that service line. But notwithstanding the additional space needs for PCI, the beds and the size of the hospital will be as a result of the replacement for Easton only.
And then this is my last question, I swear. What I'm hoping will come out of the state study is a recommendation that for very rural areas like Chestertown, maybe Garrett County, that there will be a requirement of a minimum number of inpatient beds, say 15, 20, 25, whatever it is. And assuming that the state comes forward with a recommendation like that, how would the finances work? Would you then work with the state and that group to determine how that's a sustainable model? And I'm assuming the state would probably need to step up somehow financially to assist.
That's my sense, Mayor, is that as the state comes up with recommendations as part of the study, they'll also have to clearly identify the funding sources needed to support those recommendations. One of the key members on the study is the Executive Director for the Health Services Cost Review Commission, the HSCRC, which is our regulating body that controls our rates. So having the Executive Director at the table during the study will help answer those questions about where the funding sources may come from if needed.
Sorry, Mike.
No, that's fine.